Hello everyone, I'm Dr. Srijitra from Exemplar Healthcare. Today I'm here to talk about a very commonly seen medical conditions of today, hypothyroidism. So let's discuss what this hormone is, how is this affecting your body, what are the symptoms it's produced, and what are the things that you can do in your diet and exercise wherein we can bring it back to normal and also to prevent hypothyroidism in the future. If you look into the reasons, there will be environmental factors, there will be genetic factors, like dietary changes, and stress factors especially. That is also one of the major reasons why you are ending up with hypothyroidism and many other lifestyle diseases. So women are commonly affected, especially during pregnancy, after pregnancy, women are commonly affected with hypothyroidism. So this thyroid gland is actually situated in your neck and it produces a thyroid hormone. This thyroid gland is controlled by hypothalamus, another gland which is situated in your brain. So this thyroid hormone is actually directly responsible for the BMR rate of your body or the metabolic rate of your body, or in other words, your food burning capacity is largely determined by the thyroid hormone. So whatever you eat, it has to get burned into energy. So this energy is utilized all over your body for their normal functioning. So if you don't have enough thyroid hormone, this food burning capacity will come down. So automatically you will be ending up with lack of energy. Even though you are eating food, even though you are taking supplements, your body will not have enough energy to function normally. So all your system will come down. Your digestion rate will come down, your absorption rate will come down, your heart rate will come down, you will end up in constipation, there will be a lot of hair losses, there will be dryness of skin, there will be mood swings, mood changes, sleep pattern changes, everything will be there. You will be always tired, mentally and physically you will be always tired because you don't have energy. So you look into the digestive system itself, your digestion capacity is coming down, your absorption rate is coming down, even the food moving capacity from one place to another is coming down. So you will end up in constipation. Whatever you eat, it will not get digested. You will end up in acidity, gastric symptom, GERD and things like that. So what happened to the food that you are taking? If it is not converted to energy, automatically it will be converted to the fats and it will store in your body, in your skin, in your liver, in your bloodstreams. So that's how you will put on weight. So much of fat is getting deposited in your body. So there will be drastic weight change, especially 2 to 3 kilo you will put on in a month. There will be fatty liver, fat will be deposited in the liver. Fat will be deposited in the arteries so that one day you will end up in the cardiac problems. So these are the complications of thyroid. In children also can have hypothyroidism, especially newborn children. So if the thyroid hormone is not there, it will have a direct impact on the physical growth as well as the mental growth. The child's mental growth will be impaired. The child will end up in mental retardation and physical retardation. So if at all your child is having any delayed milestones, if at all you feel the child is not active enough, I think you should immediately contact your pediatrician and take all the precautions needed, take all the blood tests needed, because it is very important for the physical as well as the mental growth of the child. So let's look into the treatment side. Definitely in allopathy you would be used to the medicine Thyronorm. So according to the level of TSH or the thyroid stimulating hormone, the doctors will be prescribing Thyronorm accordingly. Thyronorm is nothing but the oral thyroid hormone where you are taking the supplement orally. So what I have noticed in my clinic is that I have seen many patients, even after taking the Thyronorm, the symptoms is persisting, like obesity, like palpitations, because your cardiac things are slowing down. So the palpitations, the dryness, the hair loss, these things are persisting even after taking the Thyronorm hormone. So that's where the scope of alternative system like homeopathy comes in place, because homeopathy have many medications which can directly stimulate your thyroid gland and your hypothalamus gland to naturally produce thyroid hormone in your body. We are not giving any oral supplements, but we are giving medications to stimulate these glands so that over the period of time your thyroid levels will be normalized and you will be able to withdraw the medication. So generally the patients will ask me whether to stop the Thyronorm tablet while taking the homeopathic medication. So I will not advise to stop in the immediate go. Once if you have started with the Thyronorm tablet, we will not advise to stop the medication in the first go. We will parallelly start with the homeopathic medications. We will make sure that we will check the blood levels occasionally. We will taper down the medication's dosage and then we will stop it in the eventual manner. while giving the medications, we will also consider all other factors while selecting the medications, like genetic history, like environmental history, like stress history. All those things will be considered, because we are not planning to give you a lifelong medications. We are planning to stop the medication and stabilize the patient for the future. So we will look into all other details which actually cause the hypothyroidism in your body. So this is regarding the homeopathic way of treating the hypothyroidism. So now let's look into the dietary changes needed. As I have already mentioned, this thyroid hormone is directly responsible for the absorption and the food burning capacity. So as your food burning capacity is coming down, it is mandatory that you regulate the high calorie food that you are taking. Do not take this high calorie food like pizzas, like burgers or biryanis in a regular manner. And especially do not take this food at the night times, because we have very few hours before going to sleep. So it is better you take it in the morning or in the afternoon, if at all you are taking. So you try to reduce the high calorie food, you try to reduce the processed food, you try to reduce the maida and maida products. And there are certain foods which will directly impact the release of the thyroid hormones. Those foods, if you try to reduce, it will have a very positive impact in your thyroid levels. The food that you have to avoid is definitely cruciferous foods, cruciferous vegetables like cabbage, cauliflower, things like that. And the second thing is that you have to avoid the soya beans, raw tapioca, raw onions. These things have a capacity to impact the release of the thyroid hormones. So you try to reduce this food in your diet so that we can have a better result in the treatment of hypothyroidism. And definitely refined sugars, processed food, the maida and maida products you can try to avoid. So what you have to include is, you have to include a lot of green leafy vegetables. You have to include more fibrous food, because it will help to reduce the constipation. The best food that you can advise for a hypothyroidic patient is apple, peaches and citrus food, because these food have a capacity to detoxify your body, especially of the mercury, because it has a hormone called pectin. It will help in the detoxifying your body, especially with high metals like mercury. And that will have a positive impact in your body. So you try to include some of this food regularly in your diet. So this is regarding the dietary changes. And exercise. Exercise is mandatory in hypothyroidism patients, because as you know, your body capacity to burn food is coming down. You have to give your body some manual support like exercise, so that you can combust your food better. This is regarding the hypothyroidism and management of hypothyroidism. So hope you really enjoyed this video, and if you do, you please make sure to like, comment and share. And also don't forget to subscribe to our channel, so that we will get back to you with new informations regarding health, regarding mental health as well as the physical health. So saying that, you stay healthy and fit, so you take care of yourself. Thank you so much.